Okay, so we're going to be doing a standing lesson today, and starting and sitting like you are. And what I want you to remember is standing obviously is more taxing than the lying down lessons that we've done. So this is a really good opportunity to practice what we've been learning all along, which is listening to yourself, taking care of yourself, sitting whenever you need to, even if I haven't given the instruction yet to sit, and even using your mats to lie down. So if at any point I haven't said lie down yet, give yourself permission to lie down. In these kinds of classes, it's actually more of an accomplishment when I see somebody taking care of themselves than when I see them doing every single movement that I ask them to. So it's quite a reversal in our trained ways. So start by just sitting back in your chair with your hips all the way back so that your back is supported in reasonable, effortless posture. And have your feet flat on the ground. And just begin by feeling how your sits bones rest into the chair. What do you notice first about your sits bones? Do you notice the shape of your pelvis? The weight through each of your sits bones? Can you feel if there's more weight through the right or the left side? And then notice also how your legs come out from your pelvis. Do they go straight in front of you, or do they angle a little bit inward or outward? Just notice. Are they exactly the same on the right and left side? Maybe think as if you were going to draw an imaginary line down your center, from the center of your nose, your lips, your chin, your sternum, through your belly button, your pubic bone, and through the middle of your legs. And notice, if you can sense without looking, is one leg a little closer to that midline than the other leg, or farther away? Sometimes it can be difficult to notice these asymmetries, and the more you practice, the more distinctions you're able to make, and then the more use you can make out of your own explorations. So notice also how your feet are resting on the floor. How much weight do you place through each foot? Again, is there a little more on the right or the left? And does that correspond in some way to the weight you felt through your pelvis? If you noticed a little more weight through the right side of your pelvis, do you also notice more weight through your right foot? Or maybe through your left foot? Notice the angle of your foot away from that midline. Does one set of toes point more outward than the other set? More inward? Can you detect any effort that you're using in your muscles to hold your legs, hold your hips in that particular position? If you're not already, rest your hands on your thighs, and just with the right hand give your leg just a little wiggle in and out, and just notice how easily does your leg wiggle. And if it doesn't wiggle and wobble easily, then you're just aware that there's some muscles that think they're supposed to be holding on, and that's okay. It's quite common. And then give your other leg a little waggle. And is it any different? Is this leg a little looser, a little tighter, a little more or less stable? And just pause. Now place your hands on the crease where your pelvis meets your thigh. I just want you for a moment to know where your hip joint really lives inside of you. And it's on that crease about the same distance as your jaw joints, your TMJ. So take your fingers straight up through your trunk and feel your TMJs, your jaw joints. You can open and close your mouth a time or two so you know where they are.
closer to the chin or back closer to the
right
ear?
in front of the ear. Right in front of the ear. Good question. And then just draw a straight line back down to the crease. It's a little inside your nipple line. And our hip joints are actually much narrower, much more deeply set in our pelvis than many of us think. Good. And yours might be out just a little bit. But what you can do is just bend your whole trunk a couple times forward and back to get a sense of how you bend over your hip joints. And many of you might be thinking of the traditional places that most of my students think their hip joints are before we educate them. And if you get a chance at some point, be sure to look at a skeleton and see how that leg bone comes up and out to the side, but then angles sharply in. And that's where we get confused as to what our hips actually are. Culturally, we put our hands on our hips when really we're putting our hands on the top of our pelvis. Or we complain, maybe not you men, but we women, we complain about the fat on our hips, and really that's the outside of our leg. It's not our true hip joint that we rotate over. And this will be an important part for you to tune into today, because we're really going to explore how you rest your pelvis over your hips so that you can stand and walk freshly into this new year. So just rest your hands again. Feel yourself sitting. Touch base with your breathing. And then go ahead and stand up, please. And as you stand up, notice if you put a little more weight through one leg than the other. And you might just do that a time or two, noticing as you feel or don't feel if you put more weight through one leg than the other. Is that the same leg that you felt more pressure through your foot? Is that the same leg that you felt more pressure through your sits bones? Just 2 or 3 times, exploring that for a minute, and then coming to standing. And just feeling yourself in standing now. Feeling your weight through your feet. Does your weight tend to fall on the outside of your foot or the inside of your foot? Do you have more weight through your heels or through the balls of your feet? Again, notice the direction that your toes are pointed. Your toes are pointed. And don't try to correct them. There is no right way in the Feldenkrais world. But just notice if one is more pointed inward or outward than the other one. And again, notice, do you have more weight over one leg than the other? And if you can feel which leg that is, and if you can't feel which leg that is, I want you just to take a guess. If you were going to guess which leg you had more weight over, I want you to very slowly and gently shift your weight a little more over that leg and back just to the center. Doing that several times, just feeling how your foot accepts more weight, how that weight is translated through your knee, up into your hip joint, the muscles of your thigh, the front and back, the buttocks. Even the sway or the rotation in your pelvis, sometimes shifting weight in this way will cause one to turn a little bit to the right or to the left. So just notice any subtleties that you detect, and then stand again in the middle. And then do the same experiment to the other side, just slowly shifting, and really listen, particularly for any differences. It's these contrasts, these differences, that allow your nervous system to wake up and get interested. Because you so rarely pay attention to your body, most people do, unless it's calling out in pain, that when you begin actually listening for differences, the brain gets interested and starts paying attention to how it organizes the system called the body in this particular way, known as you. And if you can't quite feel the differences, try shifting a little bit to the one side and then the other. Just sort of checking out, what more can I feel? Can I feel something different about how my weight shifts through the soles of my feet? Can you feel any rotation in your pelvis or even your shoulders? Do you feel your low back supporting you any differently? And then with that new information, excuse me, just have a seat for a moment, please. This is definitely a new skill that can go on for a lifetime if you desire or are interested, of learning to listen to the multiple nuances of the body. What I have found in my trainings is that I can feel the multiple nuances of your bodies in a number of ways with a number of techniques and skills. What I particularly love about the Feldenkrais method is that I get to teach you to feel the nuances of your body, and therefore you become empowered to engage in that explorative process that engages your brain in genuine learning rather than just obeying my instructions or feeling good because I have magic hands. So I've been told. Which is nice too. All right, and again, stand up, please. And stand to the side of your chair just so you have a little room and you won't feel like you're going to be kicking your chair in any way. And let's see here. Keeping your weight on your right leg and keeping your left knee soft but straight, begin to, I meant left leg. Little dyslexia here in front of the room. So keeping your weight on your left leg, just gently begin to kick your right foot out straight in front of you and placing it back down. And notice, how do you do that? Is it all in the hip? What does your left leg, and particularly your left hip, even your spine, have to do to allow that right leg to come a little forward, maybe even a little off the floor if it's easy, and if you could keep breathing smoothly, and back down. What muscles work to lift that leg up forward off the floor? How do you have to shift your weight and balance yourself? And for some of you, this may be much easier with your eyes open and picking a point to stare at. Only our Tai Chi master over here can probably do this well with his eyes closed. Yeah, just pick a point. Soften your gaze so it's there, but it's not. And you'll notice when you challenge yourself, you'll hold your breath and you'll get really focused. And then just see if you can soften that. And then just pause for a minute in standing. And just feel now in standing any subtle changes between how you're standing through each leg compared to the beginning. And then this time, imagine that there's a stick all the way in front of your trunk, across your hip, and along your back, across your hip, down your thighs, in front and in back, so that each time you kick your right leg forward, your trunk has to tip backwards because they stay in line with each other. So you tip your trunk backwards in proportion with how far your right leg kicks forward. So what happens here? What's happening in your left leg to support you? And what's happening particularly in the left hip As you do this movement a couple more times, place your hand in that crease on your left hip again, where that hip joint is. Where the actual crease is. For most of you in this class, it's a little lower. Where the crease is. And feel how as you tilt your trunk back and bring your leg forward, you're rolling on that left hip joint. And if you can't feel it, just imagine that ball and socket joint and you're rolling over it. And just pause for a minute and just take a few steps around in a small circle just to kind of give your static posture a break there. And then come back to standing. And just as a check, put both hands in that crease and push your fingers back so that your bottom gets pushed backward and your trunk tips forward so you can really feel right where that crease is. And you might explore a little higher and a little lower to see if you can really feel where exactly where the bend in the skin is, the bend in your slacks is where that hip joint is. Okay, back to standing. And this time, same idea, shifting your weight over your left leg, but taking your right leg backwards in whatever strategy works for you. Knee relatively straight. Notice how much weight you shift to the left. Is there a big displacement of you going to the left side to get all your weight on that left leg, to take your right leg backwards? Do you tend to take the leg back without the trunk and create just sort of a gentle stretch in the front of the hip? Or do you automatically start tipping your trunk forwards? Just notice which style you do. And then try the other. So the two ways is keeping your trunk fairly upright and taking your leg behind you. And then the other way is letting your trunk tip forward in proportion to how your right leg kicks backwards. And again, with some attention on that left hip joint, how you're rolling over it. Your whole trunk is rolling forward as your leg relatively goes backwards to your trunk. And just pause, listen, make sure you haven't done too much. Take a few steps around in the circle. What's it like now, each step on your right leg compared to each step on your left leg? And coming back to standing. Scanning first, just seeing how your weight is displaced over your right leg, your hip joint, your knee joint, your ankle and foot, and how your weight is displaced and supported through your right leg, all of the joints and the foot. And then again, we're going to shift our weight to the left and take the right leg out to the side this time. Finding that soft point to focus on. And some of you take your leg out to your side and tilt your trunk a little bit to the side in the same direction to the right. While others of you take your right leg out to the side and tilt your trunk to the left. No one right strategy, just different ways of using our organization. So notice which way came naturally to you, and then try the other way. What's it like for everything to tilt? Leg to the side and trunk to the left, versus leg and trunk both to the right. Feeling how your left foot accepts the weight each time, looking for something new and different. What happens in your abdomen? How do you hold or relax your abdomen with your breath? Your back, even your shoulders. It's so easy for our shoulders to forget, for our mind to forget that our shoulders are supported by your spine, through your pelvis, from your legs. Okay. And why don't you go ahead and have a seat for a moment, just rest. Sit back in your chairs. Feel how you're sitting through each of your sits bones now. Has anything changed? Rest your hands on your thighs and give your right thigh a little wiggle. See if the relationship of your right thigh into your right hip and pelvis has changed. And then give your left thigh and leg a little wiggle. And then again, stand up, please. And just standing here, it can be more challenging in a social posture like standing to just let your face be soft, let your jaw, your lips, your eyes relax, let your breathing be full. Certainly this is easier when you're lying on your back and can pretend like no one is seeing you. And this time you're going to bring your right leg up in front of you with your knee bent. And you're going to turn over your left leg. So you're going to do a little twist to the left and to the right. So you'll shift your weight over your left leg and bend your knee, your right knee up in front of you, and just try a little twist left and a little twist right. And it's okay to keep that point on the floor or on the wall to focus. And it's okay to go a very small amount. You might only go a half an inch. And just...
Is it really wobbly in the leg that's supporting?
Mm-hmm.
Does that just mean make the movement smaller?
You can make it smaller. Mm-hmm. You could let your toe kind of drag on the floor if you feel like you need a little bit more support. But you want the rotation to happen over your left hip, not your right hip. So your whole trunk and your right leg is going to turn a little bit left and right as if all one. And you're going to breathe, maybe. And just rest. Just rest and standing. And then go back to the first movement, the first two movements actually, and take your foot forward and backward together, forward and back. And can you feel there's a certain point when you go forward where your whole trunk gets shorter, and then as you come back to neutral you get a little taller, and then when you kick backwards you get a little shorter. So we're finding your full height over your hip joint. So play forward and back and make the movement smaller and smaller, really playing with finding where you're the tallest on that hip joint. Because some people stand with their whole pelvis kind of forward, so they get shorter by sort of rolling their trunk backward on both their hips. Some people just get kind of stooped and slouched, so they're shorter by rolling forward, rolling their trunk forward on their hips. And then just pause. And then with the same idea in mind, take your right leg out to the side and right back to center, but playing with where you feel yourself get shorter over that hip joint and where you feel yourself get taller. And this can even be done with both feet on the floor if this is getting at all challenging. You can just sort of tilt your trunk to the left over your hip as if your right leg was going out to the side. And you can feel how you get shorter and then how you get taller when you come back over the top of your hip joint. And you could tilt a little to the side and backwards and feel that backwards tendency to get shorter. And you could tilt a little bit to the left with your trunk, either taking your right leg out to the side or just leaving it resting but shifting your weight over the left. And go a little forward and feel that way of getting shorter. The top of your head gets closer to the floor. Just walk around a little bit and then find your mats and take a full rest for a moment. Is your sense of your hip joint getting any clearer? Maybe you're more confused. Sometimes the best clarity comes out of chaos. So occasionally there's a little intentional chaos built into this method. Lie down, take a full rest. Just surrender your body to gravity's gentle tug, holding you here on earth. As you lie here, notice any differences that are apparent between how your left leg is resting and how your right leg is. Does one leg feel longer or shorter? Lighter or heavier? Closer or further away from the midline? Take a moment in this lying position to find where your hip joints are. And then what you can do is just slide one of your knees up to bend your knee and your hip. And if your hands are right on that crease, you'll know you're pretty close to the right place. The tendency is often to go a little higher or further out to the side, because that's often how most folks have imagined it through the years. And just rest your arms again. Rest your mind. Rest your body. And then find a way to gently come up to standing again, please. And just a couple more times focusing on the left leg, the left hip. Do whichever movements you're inspired to do to really explore how your trunk moves over your leg through the hip joint. And at what point you're at your tallest, and what point you're shorter, and how that whole ball and socket joint in there supports such a variety of movements and choices throughout each and every day. So often, because of messages that we've received culturally, socially, religiously, through the centuries, we sort of lock our pelvis and our hip joints together. So many people are really limited in the diversity of movement available where the pelvis meets the hip joint. And the more variety you have available to you here, the more balance you have, the more responsiveness you have, the more subtle differences you can make throughout your whole spine, your shoulders, all the muscles in your back. Good. And then just stand again and shift your attention to your right leg. And just a couple times, shift your weight over your right leg as if to prepare to pick your left leg up. And when you've really gotten to know that right leg, do you tend to sink into the right hip, or do you get tall as you shift your weight over onto that right hip? And then gently prepare your left leg to bring it out in front of you and place it back down, beginning the same exploration we did on the other side. Again, at this point you might want to open your eyes and softly focus either on the floor or the wall in front of you. Feel how your right foot supports you compared to your left foot. We often have a dominant support leg and a dominant mobility leg. So you might notice that you're so relieved to finally be shifting your weight onto your right leg, or how much less stable you are on your right leg than you were on your left. This lesson can also be done holding on to your chair, the back of your chair, or holding on to a countertop if balance is particularly challenging for you. And again, notice the variety of ways, but the two main ways you can kick your left leg forward is holding your trunk upright, or maybe even bringing it a little forward also, or keeping the left leg in line with the trunk so that when your left leg comes forward, your trunk tilts backwards. And when you're ready, go ahead and explore backwards also. So taking your foot forwards and backwards. No falling allowed. I do know a good therapist, though, if you hurt yourself. I should be careful what I say in these. These are the ones I'm going to be making, to give out to people. To delete that section. Yeah. And really feeling each time, what's your knee doing? Have you forgotten that your knee is another joint between your foot and your hip? How do you tilt over and roll back and forward over that hip joint, that wonderful, wonderful ball and socket, 360-degree, not really, hip joint. It's got a lot of motion, though, a lot more than an elbow or a knee. And then when you're ready, why don't you take a seat for a minute? We get so goal-oriented, we want to try all these things. So just take a seat, rest. Tune into your pelvis. Feel your breath expanding into your lower abdomen. or not expanding into your lower abdomen. Just feel where your breath goes. Have a sense of how your legs connect to your pelvis via your hip joints. And I wonder, sitting here, is there more stability through the sits bones of your pelvis or through your feet? If you got rid of one or the other, which one could you still sit up with if you didn't have the other? And then come to standing again, please. And continue the exploration over your right leg by taking your left leg out to the side. And you can take it to the side and let your trunk stay upright. You could really focus and put a constraint of really not letting your trunk tilt at all. Or you could let it tilt a little to the left or to the right. Each time, add a slightly new angle. And have the interest go from all of you, how your whole body experiences these tilts, and then back to the focal point of that right hip joint. How are you rolling over and getting acquainted with this part of your being? Gentle. Watch how the mind traps you into getting goal-oriented, doing more, which sometimes means listening less. Often the bigger, grander movements that we try to achieve create more effort, and that effort creates more static, and we have a less clear kinesthetic picture for our brains to perceive. And if you haven't yet, try the rotation, where you shift your weight onto your right leg. Either keep both feet on the floor, or if you're able to, bend your left knee a little bit in front of you and rotate your whole leg and trunk left and right. And if that's too difficult, just keep both feet on the ground, but keep most of your weight on that right leg. And have a seat, please. Placing your hands on your thighs. Again, give the right leg a little wiggle. How much freedom can your leg have from your pelvis? So can you sit more through your sits bone and pelvis and let your right leg just wiggle, waggle free? And then try that with your left leg. Interlace your fingers together. And then just bend forward and hook your fingers over the front of your right knee. So you're just a little below the kneecap. Now, with as little effort on the part of your leg as possible, try to let your right leg be completely passive. Just tilt backwards until your arms are lifting your right leg passively into the air. So as much as possible, let your arms, your shoulders, the support of your opposite foot. You might notice that your left foot is pressing into the floor. And see if you can, nice. And if you're able to tilt fairly far back, make a couple circles with your leg. Let that hip joint rotate counterclockwise and clockwise. Breathing. And as you lower your leg back down to the ground, just when you feel your toes touching, see if you can just drop it so your heel kind of plunks on the ground. Can you just let the whole leg go? So sitting isn't about the thigh, the groin, the hamstrings anymore. And then see if you get any change in your wiggle. Yeah, good, good. This can be a wonderful just mini break to take during the day, especially if you're at a sitting job, to just lean forward and try to kind of disconnect those hip and leg muscles so that they're not holding you so tightly throughout the day, and it can allow you to sink into your sits bones and let your pelvis and your spine, the bones of your pelvis and your spine, do what they were meant to do. Hold you up. And then try that with the other leg. Except this time, interlace your fingers, and now move them one finger over so you're interlaced non-habitually. Just feel that for a moment before you reach for your knee. Feel that non-habitual interlacing. Such an interesting thing. It really calls to the brain to wake up. Shift again back to your habitual interlacing, like an old slipper, just so comfortable, it's worn in all the right places, and then shift one finger over and it's like a brand new pair of shoes, little rough, just a little unfamiliar. And then go ahead and lean forward. Really let your left leg go to the support of your hands and your arms. And you'll feel to do that, you're really connecting your thigh bone, your femur, into your pelvis, because your arms will press it back and really make a strong skeletal connection. Breathing, lips and eyes soft. And then as you slowly lower it down to the floor, just when your toes brush the floor, drop the heel down and just let it go. Let it go. And then just try the little wiggle again. See if those hip joints are freeing up some. Really opening up for some of you. Nice. Very nice. And come to standing again, please. And do a couple of the movements forward and back, bringing your right leg forward and back, and then shift onto your left leg, comparing, bringing your right leg forward and back. Just feel, maybe you stand a little taller through one hip joint rather than the other. A lot of people have an apparent short leg, but it's more because of how they stand and organize their hips, their pelvis, and their back than being a true skeletal shortness. So just see if you can sense, if as you shift your weight onto your hip, as you tilt yourself forward and back, if there's anything from one side to the other to give you some new information about yourself. And then again, compare going side to side. And then with both feet on the ground, see if you can just roll your whole pelvis forward and back so you're getting shorter by tipping your trunk forward on your hips, coming to your full height, and then you're getting shorter by leaning backwards, and just really feeling at what point forward and back. And make the movement each time a little smaller, until you're resting, possibly in a very new place. A lot of people I see are pulled back a little bit, like they're almost afraid to fully enter the world or the day. So you might find your middle to be a little more forward than what has become familiar to you. And when you find that middle, then shift side to side. So what you'll find is on one hip you're rolling towards the center, while on the other hip you're rolling to the side. But shift your trunk right and left with both feet on the ground, just feeling the highest point in the middle. And making the movement smaller and smaller until you find your middle from side to side. And then remembering back to the beginning of the lesson, how you felt yourself standing through your legs. Which leg you have a little more weight through may be the same, it may be different. And just a couple times shift your weight over that dominant weight-bearing leg. Just notice what's changed. And then shift your weight to the other leg. And then just take a few moments to lie down and let your body rest again and assimilate the new information. And after a few moments, you can roll back to your side and stand up and experience standing and walking again with this new sense of yourself. Thank you.